One of the most common questions we get asked on a regular basis is about skin changes in pregnancy. Melasma, acne, you name it. So today, we thought we'd talk about the 4 most common skin changes in pregnancy, why they happen, and what you can do about it. We'll get into this episode right after this quick message. Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it.
All right, Sarah, this is a topic we get so many questions about.
Many questions.
Skin changes in pregnancy. Now, pregnancy is wild. It does things
It
to
is.
our body that you can never imagine. And that goes along with skin too. And our hormones are changing and everything's growing and there's just so much stuff. So we thought we would do a brief podcast on kind of the 4 of the most common skin changes that we see in pregnancy and kind of what you can do about it, if anything. Everyone says you'll glow through this pregnancy time. And for some people, that's certainly true.
Yeah.
But for most of us, the hormonal shifts in pregnancy can lead to other changes in our skin and hair, which may not show our best side. So let's focus on skin for this episode. So did you know that skin is actually the largest
Totally.
organ in your body? And it too can be affected by pregnancy.
What are some of the most common changes that occur during pregnancy, you might ask? Number 1 is dark spots appearing on your body. The body produces melanin, which is the substance that gives color to your skin and hair. And this can be increased in pregnancy due to the increased levels of estrogen and progesterone, which stimulates extra melanin production. Common areas that can be affected include the breasts, the inner thighs, and the face. It is so common on the face. There's actually a term for it called the mask of pregnancy, and melasma is the other term you might hear. Now, it's more common in people with darker skin who naturally have more pigment in their skin than light-skinned people. Exposure to sunlight can make it more noticeable. So some things that you can do to help prevent or help lessen it is by using sunscreen regularly and wearing a large brimmed hat to protect your face from the sun. Now, topical vitamin C might also help to lighten melasma, and it's considered safe to use in pregnancy, as is azelaic acid, which is applied topically. And there's one other thing. What is it? Niacinamide.
There you go.
There you go. One other thing. Melasma usually fades once your hormones return to normal postpartum. Haha, normal. But in some cases, it can remain longer term. Now, there are some treatments that you can do once pregnancy and breastfeeding are finished. And so it's good to chat with your provider about this. Also closely linked to melasma is the Linea Nigra, which is that dark line that runs from the navel or your belly button down to the pubic hair region. It will often have been there previous to pregnancy. It just wasn't really noticeable. And it often starts to get a lot darker midway through your pregnancy. So it's similar to melasma. And so the same prevention and treatments apply. And it generally decreases quite significantly after pregnancy as your hormone levels return to pre-pregnant states.
Number 2 is stretch marks. This can be one of the most feared complications of pregnancy when it comes to our skin. They are very common, occurring in 50 to 90% of pregnant people. They often start as red or purple lines or streaks, and then they'll fade over time to become pale lines or marks on the skin. Most common sites that are affected are the abdomen, breasts, and thighs, similar to when we go through puberty. They occur for just the reason it sounds like. When the skin is stretched and the hormonal changes of pregnancy can make your skin more likely to get these marks. It occurs when the middle layer of your skin, or the dermis, becomes stretched and broken in places. There's quite a bit of genetic predisposition as your skin's elasticity will impact how many you get. So we get questions all the time about what people can do to prevent or treat stretch marks. So far to date, unfortunately, there's no evidence for any topical preparations that can help to decrease or prevent stretch marks in pregnancy. Good moisturizing of your skin may help with the itchiness that often accompanies stretch marks, and it can't hurt. But unfortunately, there's no magic prevention or cure.
No, and to add to that, let's call them tiger stripes.
Ooh.
Because you are a powerful tigress. And yeah, because it's the middle layer, all those topical claims, there's just no evidence behind them. So I'll admit, like, I try them too, but just know that if you're paying $200 or $300 and it's claiming to get rid of your stretch marks, it might just be time that they fade with.
I asked a plastic surgeon that question once if there's anything that people can do for their stretch marks. And he said, just hope that it's below your belly button because then you can get a tummy tuck. And actually just surgically remove them.
Yeah.
Which is, for some people, that's what they choose to do,
Absolutely.
and more power to them. But that's a pretty expensive and significant surgery.
Oh, yeah. So tiger stripes, let's normalize them.
Hey, Sarah. Do you know what I've never asked you? Did you take a prenatal course when you were pregnant?
We did. Even though I'm a maternity care provider, my husband and I thought it would be an important process for us to go through together.
That's so cute. It must have been so hard for you guys to coordinate your busy schedules, though.
Oh, tell me about it. I was a medical resident at the time, and he was working full-time. We really struggled to find a course that would fit our needs and ended up doing a semi-private course that still was challenging to schedule and quite expensive.
Wouldn't it have been nice for you guys to have access to an online course with evidence-based content that you could do from the comfort of your own home or on your own time at your own pace?
You're telling me if I had had access to something like our Pregnancy to Parenthood Prenatal Masterclass, it would have been a game changer.
And that's the big reason we put this course together, to provide parents with access to reliable, comprehensive prenatal education from the comfort of their own homes and the ability to watch it and rewatch it when and where they choose.
Plus, it's got so much great information about preparing for the fourth trimester, which I'll admit, I felt really unprepared for. We focus so much on labor and birth when we're pregnant without understanding how challenging breastfeeding in the fourth trimester can be.
I hear ya. And that's why we put together such a comprehensive module all about what to expect for the fourth trimester and for your newborn.
If any of you listeners are pregnant and thinking about a prenatal course, I may be biased, but I would 100% recommend our online course. Head on over to www.shefoundhealth.ca/masterclass to check it out.
We promise you won't be disappointed or your money back.
Okay, number 3, acne in pregnancy.
I knew I was getting pregnant because I started getting acne. I rarely get acne. And in fact, my second pregnancy, my husband asked if I was pregnant before I actually knew because I started getting some zits.
So many pregnant people suffer with acne in pregnancy. And this, again, is due to those silly hormonal shifts that happen in pregnancy. So unfortunately, due to the fact that we need those hormones to maintain our pregnancies, there's not much we can change from that point of view to prevent acne. But there are lots of things that we can do to help manage it that are safe in pregnancy. So some good general recommendations are, number 1, wash your face twice daily with mild soap and water and mild exfoliation. Number 2, and this one can be really hard, but try and avoid picking or scratching at your acne to avoid scarring. And number 3, try to choose oil-free cosmetics. Now, in terms of managing the acne that may already be present, there are certain topical products that can be safely used in pregnancy. These include topical benzoyl peroxide, azelaic acid, salicylic acid, and glycolic acid. So we always recommend you check with your care provider before you use any new products in pregnancy. Now, we absolutely do not recommend using any vitamin A preparations in pregnancy. We also absolutely avoid the oral preparations of acne medication in pregnancy.
So last but not least are spider veins. These are those tiny red veins that can appear on your face, neck, and arms during pregnancy. They also occur due to the hormonal and blood flow changes in pregnancy. They generally cause no problems and often improve after the pregnancy is complete. Anything that helps to keep your blood flowing smoothly through your veins will help to decrease these spider veins. So regular movement, avoiding crossing your legs, using compression stockings to keep the blood flowing through your legs regularly are all some great tips and tricks to help decrease spider veins and also varicose veins. You also want to avoid constipation, so staying well hydrated and adding fiber as needed to your diet. And if you need to, add on a little bit of Restorelax or Laxaday or Miralax, which all help keep your bowels moving and are very safe in pregnancy.
And now, once you're done being pregnant, Often they fade, but if they don't and you really don't like them, there are safe, easy cosmetic procedures you can have to get them removed. And one of the common ones is called sclerotherapy.
Correct.
And I think they basically inject like
Sugar.
sugar water,
Yeah.
right? Yeah. And then it causes the veins to collapse. Anyway, so that is really readily available in a common and safe procedure that can be done by most medical aesthetic providers. Now, it's not covered by extended benefits, generally speaking, because it's a cosmetic procedure. But again, it's something that's available to you. But I think the message that we need to reiterate is we also just need to normalize these body changes in pregnancy. Now, I absolutely understand if people feel more comfortable in their own skin by getting things like the melasma, the stretch marks, and the spider veins treated. You can also just rock them and normalize them too, because we're really seeing a big culture shift.
Yeah. And if you want to know more about skincare and pregnancy, Sarah and Dr. Bree did a great episode. We'll link it in the show notes below around skincare and pregnancy and kind of what's safe and what's not. So certainly if you're needing a little bit more support around just general skincare and what you can do to maintain it and support your skin in pregnancy, have a listen to that podcast and we'll link it in the show notes below.
Thanks for listening.
Have a great day, guys.
Go put your sunscreen on.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.